344 cases to 8 p.m. last night of community transmission.
Another spike in New South Wales and the sobering reality. Up to 201 infectious in the community.
Over the last 2 days, we have seen a surge in the number of cases and we expect that to continue.
Sadly, 2 further deaths were also recorded. A man in his 90s and a man in his 30s.
He was not vaccinated but had some significant underlying health conditions. I just pass on my sincere condolences and sympathies to their loved ones.
There's now more than 6,000 cases linked to this outbreak and 34 deaths. Right now, 62 people are in ICU.
57 of that 62 are not vaccinated, so you can see that the vaccine works.
But some positive news for the previous epicentre of Fairfield and Canterbury Bankstown.
We are starting to see a decline, so that intensive work we've been doing in those areas is starting to have effect.
But the virus is on the march.
Bayside, Burwood and the inner west are starting to have an increase in cases.
And while there are concentrations of cases in some key areas, across Greater Sydney, small numbers are everywhere. The Delta variant causing chaos across the state, seeping into more regional towns, with Dubbo now thrown into a snap lockdown after a second positive case was confirmed.
We are a united community. There is every reason in my mind to think that we will contain and eliminate the virus from the Dubbo region.
And a growing cluster in the Hunter, 14 new cases overnight.
Hunter does not look like it'll come out of lockdown later this week. However, we'll await the health advice.
Luckily, no new cases for lockdown Tamworth, Armidale and Byron Bay.
They're all positive signs.
With New South Wales Police charging the 52-year-old COVID-infected man who allegedly travelled from Sydney to Byron, causing the North Coast region to shut down.
There's a lot of locals that we're beyond frustration and now we're sort of even get over the upset part. We're just so angry because this could have been completely avoided.
That sentiment echoing out across the state and the nation tonight.
It escaped from New South Wales and it came here to Perth, escaped to Queensland, escaped to Victoria and South Australia. By doing what they're doing, they're risking the lives of their citizens and they're risking everyone else. I do not understand why they're not prepared and they don't have the backbone to do what is required.
And we're just hearing that moments ago, 8 different local government areas in Western New South Wales have gone into a 7-day lockdown. It's the LGAs of Bogan, Burke, Brewarrina, then Coonamble, sorry, my little auto cue went a bit nuts there, Gilgandra, Narromine, Walgett and Warren.
We've got a lot of... We were talking earlier in the show about the idea that people are sometimes not getting tested because they don't have the financial support. We're getting a lot of feedback that's come in on that. Katrina on Twitter tells this story, which is interesting. I was tested on Monday because of a mild cold. I'm still waiting for the result today. I have no sick leave left, so I will need to take long service or unpaid leave to cover the days I'm forced to take off. Gemma on Facebook says, I just missed 3 days of work because my results took over 72 hours to come back. Now, I know it will take time for results to come back when you're testing 100,000 a day and whatever. And so it's not... But in that situation, when stories like that are going to be circulating, doesn't that mean you really then do have to step up? You need to remove every disincentive.
And in Victoria, that wasn't the case. I mean, I think for most of last year during the harsh lockdown, tests were coming back within 24 hours. And Daniel Andrews today said that if you're getting tested in Victoria now, you're certainly getting it back within 24 hours.
I think Victorians weren't testing in the numbers they are in New South Wales, which is great that New South Wales is doing that. Yeah. But then you need to support them.
But that news that Rachel just brought us, this is now in the far west of New South Wales. It's gone west of Dubbo. So it's gone up through Tamworth, Armidale, into Dubbo and now out to these remote communities. They don't have the health services out there that can cope with an outbreak of COVID. So the idea that you could put a ring of steel around Sydney and keep it there, that's gone. It's now loose in the whole state.
Well, and in these shires, especially in Walgett, you're talking about a significant Indigenous population. Correct. We've been thinking about over a long time the dangers that this poses to Indigenous Australians because they're at higher risk.
And guess what? Out there, not many people are vaccinated. And, you know, of the 57 in ICU, 62 in ICU, 57 have been vaccinated. There's not much vaccination out in far west New South Wales.
So, Rach, we heard from people around the state in some of those remote areas now expressing real anger at the way the New South Wales government hasn't protected them. Do you feel that, like, I mean, you're obviously in Sydney, not in the regions, but do you feel that that question about it getting out to the regions is starting to bite a bit more?
Yeah, and I think everybody's worried about it. And I think everybody in New South Wales is so frustrated because, well, most of it, at least in my world and in my life, we're all kind of doing the right thing and it's still getting out. For a lot of people, going for a test and waiting for things, it's not just an inconvenience. We see a lot of the disease spreading because people have to put food on the table. They can't take time off. So for some people, it is just so stressful. And getting out into those regions where, as Pricey says, there's not the support out there, it's terrifying. It really is.
From expert opinions to in-depth analysis and reporting, the Project YouTube brings you the biggest stories from Australia and around the globe. Hit the subscribe button now for news delivered straight to your feed.